Hi, I'm Anne Marie Dougherty, CEO of the Bob Woodruff Foundation. I'm so grateful that the work Sergeant First Class Robinson and his family started years ago has resulted in the passing of this historic act and in the expansion and extension of VA healthcare eligibility for generations of veterans exposed to toxic substances. Today, with our partners at the Department of Veterans Affairs and the Iraq and Afghanistan Veterans of America, we'll help you understand the PACT Act and how veterans who have been exposed to toxic substances can access VA healthcare. Thank you for joining us today.
It's amazing how many civilians have no idea what our military faces. I was married to this soldier, and for 10 years I had never heard the word burn pit. Keith Robinson was everybody's best friend.
Keith was the ultimate soldier. He was so proud of his service.
He left for Iraq in 2006, 2007. In 2016, Keith started showing signs of illness 10 years after his deployment. I'll never forget that day because when we walked in, the oncologist came into the room and he knew we had a 3-year-old, and he got really emotional and the words came out, "What have you been exposed to?" Keith said he wanted to try to fight the cancer. He wanted to tackle it head on. He ended up living for almost 3 years, which was good, considering we had 4 to 6 weeks technically on that first appointment.
That's Cinderella and a royal friend, it says. All right, baby.
But it was very frustrating. You think when you're gonna come home from wars, you're gonna be covered if you come down with something service-related.
There's an assumption that veterans have medical care for the rest of their lives, and it's absolutely not true.
His dying wish was that he wanted to make sure that burn pit related illnesses are going to be covered by the VA.
It didn't take long before I realized that there were thousands of Keiths out there. So I was like, well, not going to stop until we get them all taken care of.
My mother wore Keith's military jacket in order to really try to start bringing more awareness. She's definitely a true warrior.
The fight that was required in order to get this legislation across the finish line was monumental.
I am honored today to be joined by 4 panelists who have committed themselves to helping us and our military veteran community navigate through that confusion. So thank you to each of our panels for taking time out of their busy schedules. I'm thrilled to have these experts with us. We have John Bursler, the Chief Veterans Experience Officer with the Veterans Experience Office at the Department of Veterans Affairs. Prior to this role, John was the CEO of the Houston-based collaborative Combined Arms, and John served in the Marine Corps. Melissa Bryant is the Senior Advisor for Strategic Engagement in the Office of the Secretary for the Department of Veterans Affairs, previously Acting Assistant Secretary and Deputy Assistant Secretary for Public Affairs at the VA. And Melissa is an Army veteran. Steve Miska serves as the Transitional Executive Director, PACT Act Office of the Secretary for the Department of Veterans Affairs. And prior to his VA service, he founded Servant Leader Citizen Consulting to serve the nonprofit community. Steve is an Army veteran. So I'll just pause for a moment. We have 3 VA representatives because of their very complementary roles. And I know this is imperfect, but the way I think of this is John works for customer experience and customer service. Melissa's focused on targeted outreach and learning, and Steve oversees implementation of the PACT Act within the VA. The Secretary trusts and has empowered those 3, and that's why they're the right people to join us today. And I'm thrilled that we also have Jeremy Butler, who you just saw in the video as well. Jeremy is the recent CEO of the Iraq and Afghanistan Veterans of America. He currently serves on their board. IAVA's mission is to connect, unite, and empower post 9/11 veterans, and the IAVA leadership, it played a really important role advocating for the passage of the PACT Act. And Jeremy is a Navy veteran who's also currently serving in the Navy Reserves. So thank you all. I've seen the number of participants increase through the comments so far. For the audience, I'd like to encourage anyone joining our call to type any questions in the box at the bottom labeled Q&A. And we're going to reserve some time at the end of the webinar to address questions. So let's dig in. Steve, can you talk about the key components of the PACT Act? What do we mean when we say PACT Act?
Sure, thanks, Meg, and thanks for having us today. Really good video. So I love that opening. It underscores, I think, the reason why many of us, John and Melissa and myself, of course, but also a lot of, over a third of the VA is veteran employees, and we bring mission to work every day. So the PACT Act transforms the way the VA looks at presumptive conditions, and we as a result of the advocacy, not just of Jeremy and his team and others, of recent veterans like our generation, but Vietnam veterans, that have been advocating for generations. It incorporates that, it codifies it into law, so that we've got a process where we continually look at new potential exposures and tee up recommendations for the Secretary to review to determine, is this something that was caused by virtuous service, and should it have benefits associated with it, and healthcare. So it does that. It expands benefits for generations of veterans, Vietnam, Gulf War, post 9/11 generations of veterans. And it offers healthcare as well as part of that. And so anyway, the main messaging around it that we want members of the audience and the veteran communities that you operate with and in to know is, please apply. Apply for benefits and care now, don't wait. It was passed in August. There's a window, a one-year window. So up until August 10th, if veterans apply, they could get their benefits backdated to last August of 2022. And there's anxiety out there that we've seen and we are actively addressing with respect to, if I currently receive benefits, what are the likelihood of my benefits, going down? And we're just here to tell you, if you apply based on exposure conditions that are listed in the PACT Act, you have a 97% chance of your benefits either remaining the same or going up. And then there's other things going on out there with respect to, Camp Lejeune and lawyers reaching out. Applying is free. You don't need to pay anybody money to apply for your benefits. You can apply either directly through the VA or through veteran service organizations out there. We have screened over 3 million veterans already. We're processing over 8,000 cases a day, which is well above historical rates that we've been able to achieve. And a lot of this is due to our efforts at expanding our capacity to be able to implement this very comprehensive law. And so that's, I know, long-winded, but to set the stage, Meg.
Thank you, Steve. Jeremy, you're out and about and you're collecting data from your members. What are you learning about what they know and don't know and are confused about?
Thank you. Yeah, so we, IAVA did a couple of polls once the PACT Act was signed into law. We did one I'm flipping over now my notes here to make sure I get one in February. We actually did one in October of last year and then one again in February of this year. And sort of the two key things that we wanted to know is, are people aware of the PACT Act and where are they getting their information from? And the reason we wanted to do that is because, for IAVA and for so many of us, the last year has been all PACT Act all the time. And so I was really interested to know how the larger veteran community was aware of this, especially because it doesn't just affect the post 9/11 generation. You know, that's one of the things that's so amazing about this legislation is it goes back not only to Vietnam veterans, but even veterans from before that. And so getting the word out really means talking to every single veteran that's in the country today. And so what we found in a nutshell is that a lot of veterans still had not heard about the PACT Act. The first poll that we did in October had about 1,000 respondents, and less than half had actually heard about the PACT Act. And then we kind of dug into some more details of, do you know about the benefits for those that had said that they were aware of it? And the numbers kind of dropped from there. So some had heard of it, but they really didn't know any of the details. The follow-on poll that we did in February, luckily and thankfully, the numbers were going up, but it still was only just above 50% that at this point had heard about the PACT Act and really knew about the details. So the key takeaways were, one, that we really need to continue doing these types of events to get the word out. And then the other thing was that one of the other questions was, where are you getting your information? And it was really split. It was maybe a quarter were getting information about the PACT Act from the VA, a quarter was getting it from the traditional news sources, a quarter were getting it from VSOs like IVA and others, and a quarter were getting it from sort of social media and things like that. And so another key takeaway from our polls really is that, one, we need to get the word out more and more, and two, we really need to make sure we're doing it across all the available spectrums. And I do want to give credit to the VA. This is one of the things that we have been really impressed with the great variety of resources that they are putting out directly, but then also sharing with VSOs like IAVA and others so that we can help get the word out, and then those can be shared, and that's been incredibly useful.
Thanks, Jeremy. Melissa, when Jeremy says that a lot of them were learning from the VA, or that quarter portion that we're learning from the VA, in a lot of cases that meant you, because you've been out on the road and holding listening sessions and talking to veterans as well. What are you hearing?
We're hearing the same things that Jeremy just described. And one of the things that we want to continue to focus on is, as you mentioned at the outset, targeted outreach. And so we recognize that if you're in the advocacy space, if you're in the DC bubble, you hear about PACT. You understand that PACT is an acronym. You know all the ins and outs of the bill. And as I'm seeing questions that are coming in through the Q&A, if I had to aggregate them, it's into, well, what about this issue for me? And does it answer these questions? And so that tells us that we need to, one, just continue with repetition of getting the word out of what is within the law. Two, encourage veterans to apply regardless of whether it's within the scope of the PACT Act or not. Here at VA, we want to make sure that all of your service-connected disabilities are accounted for. And the only way we can do that is if you enroll in healthcare, if you file a claim. And so that way we're able to understand better the clusters of those who may have been exposed that are maybe not within the PACT Act. We can understand those that are within the PACT Act. And then we can also understand by geographics and by demographics of who is in need of greater outreach and engagement. And when we say engagement, that means not just us handing you a flyer and then putting the onus entirely on you, but then also having that feedback loop closed. That's a lot of what my colleague John does, is making sure that we are speaking to the customer experience, the customer being the veterans, their caregivers, survivors, and families. And so really in making sure that we're getting the word out, some of it's kind of, the blanketing of the airwaves, and that's through traditional media. But some of it really does have to go through not just the veteran service organizations and other NGOs, but we need to make sure that we're reaching veterans where they are, coming to community centers, coming to faith-based centers, coming to schools and places, and talking to survivors who may not even identify as survivors, which is a huge challenge that we have, and making sure that folks see themselves or see their loved one who may have even passed on as someone who may be eligible under the PACT Act. But I have to say, again, if you believe that any part of your service may have resulted in a service-connected disability, please do come on in to apply for VA benefits. Apply for benefits, apply for healthcare.
Thank you. There was a lot there, and I'm going to be coming back to you, Melissa, especially about the survivors, which we will absolutely be talking about. John, you've been taking a lot of lessons learned, and not just learning, but doing things to make it easier for veterans, given these lessons from the field. Can you talk about some of the things you're doing and how it's helping?
Yeah, absolutely. So one of the, when you file for your claim, which Steve mentioned earlier, we can't stress enough, just, go in, file for your claim. If you're already enrolled in VA healthcare, go in and get your screening. You'll get your toxic exposure screening as part of your normal routine of care. So when you see your primary care provider or any of your specialty care providers, you're going to get screened. But if you haven't been back to VA, or if you tried us 10 years ago, try us again and get a screening and file your claim. What we wanted, one of the improvements we wanted to make is this concept of, if you come in for your routine care and you get a toxic exposure screening, we want to make sure that you're aware of how to file your claim for those toxic exposures that you may have been exposed to while deployed. And we produced a 2-pager that can be handed out at the point of care, or that can be mailed following your appointment, or it can be sent via email or other modalities. So we're making sure that whether you're engaging in the Veterans Health Administration or the Veterans Benefits Administration, you're getting the same message on how to file a claim or how to pursue a toxic exposure screening. We did a survey of about 120,000 veterans last fall who had already submitted their claims from that August 10th signing of the PACT Act, and thanks to our partners that helped get all of the legislation through, of course, that asked, how did they find out about PACT? What motivated you to file a PACT Act claim? The results were pretty, astounding. Like, veterans want better access to benefits. They want better access to care. They want to make sure that their families are taken care of. They're hearing about PACT and toxic exposure benefits and care from their veteran service organizations like IAVA, like Bob Woodruff Foundation, or directly from VA. It was very close, actually. Or there's TV and radio ads. So those are also big modalities, as Melissa mentioned. But what we're also learning is that most of the veterans have already been engaged or enrolled with VA before. And so the biggest challenge for us is to reach that untethered or unenrolled population. And we really need your help, those of you here on the call today, to reach out to your buddies who you served with, and let them know to go to va.gov/PACT or call 1-800-MY-VA-411 and get connected to care and benefits that you have earned. We also need the help of our partners, the Bob Woodruff Foundation and IAVA and Vietnam Veterans of America and many others to relay that information. So all of us here on the panel have been exposed to toxins on deployment, and we have, and I can speak for myself and my experience. I filed my claim. I went to va.gov. Was a more TurboTax experience than I thought it was going to be honest with you, for sinusitis and rhinitis, because I've had chronic sinusitis and rhinitis since I got home from my second deployment. And it took a couple of months. I got my rating back at 0%, meaning that I can be seen at VA for the rest of my life for those conditions, for that chronic sinusitis and that chronic rhinitis, which is incredibly meaningful to me, because I get a lot of my allergy, pills and nasal sprays and allergy shots from VA, and I really appreciate that care. So we're also learning about, the last thing I'll say is about a lot of scams and fraud that is being targeted specifically at veterans who may be eligible for PACT benefits and care. So there's a lot of information out there that we can share, like kind of a do's and don'ts of making sure that you're going on and finding out about the accredited organizations that work with VA to file a claim, making sure that you double check that firm, or don't sign a contract agreeing to pay an unauthorized company a percentage of your benefits payment in exchange for assistance with your VA claim, those types of things. And then if you do see fraud or you experience fraud, please contact the Office of Inspector General hotline, which I can put in the chat, of course, but it's easily discoverable online, and you can call 1-800-488-8244, and I'll put that in the chat here. Back over, Meg. Thanks.
Thank you. So, John, I think in order to recognize fraud, people need to understand what the process is supposed to look like. So if you go on the website, you said you go through something that feels a little bit TurboTaxi and evaluates you. If you call the number, what happens? And what does it mean to be screened? Like, what is the actual experience?
Yeah, and then I'd ask my colleagues on the panel to jump in. I actually had an in-person appointment at my local VA medical center planned for my annual physical. I actually ended up doing it remotely because I was working. I couldn't get to the VA medical center that day, and when I did, I got screened via telehealth. And so my primary care provider and the team that works with my primary care provider asked me a couple of questions about my deployment and about if I was exposed to any burn pits or sandstorms or any other toxins that we can also share a list of. And from there, she asked me if I'd like more information on how to file my benefits, file my claim for those toxic exposures. And I absolutely said yes. And 6 days later, I received a very informative brochure that the Veterans Experience Office helped put together with the PACT team. And it was a pretty seamless experience. We know that that's not happening in every single instance. For folks that go and get their screenings, for folks that are filing their claims. That's why we're taking those lessons learned back to your question earlier, Meg, of how we're trying to improve that experience and make sure we're sharing that information from the Veterans Health Administration and the Veterans Benefits Administration.
Okay.
And if I could just dovetail a little bit on what John said here, we are learning as we go. This is very much a learning and adaptive process and understanding what is the experience of the veteran, and not only and taking on, as he stated, our own personal experiences, all of us here with filing our own claims, but then also taking in how is this working across regions, how is this working across local areas, because I'm seeing some questions in the chat of what do I do within my local area, and I'd say step one, reach out to either your county VSO or to your local VSO, or just go, as John stated, to va.gov/PACT or dial 1-800-MY-VA-411, where an operator can guide you through the process to be able to start filing a claim or to enroll in care. If you're not enrolled, you will get that screening once you are enrolled, and as a part of your normal routine care, that's when those screenings come up. And again, it's those 5 minutes or so of questions that speak to the type of exposure you may have. I wanted to answer that point on the type of exposure, because I'm also seeing questions in the chat where people are saying, well, what does it mean for burn pits? What about Agent Orange and and everything that's in between, radiation? Some of these are on US sites, some of these are foreign sites. Does it have to be a part of a conflict of war? The answer is all the above, in the sense that, the PACT Act in of itself, is the way that laws are created, is a compromise, and I'll let Jeremy speak more to that of, the ins and outs of how we got here, of what's in there. But when John mentions rhinitis, sinusitis, and asthma, those were presumptive conditions that VA added actually prior to the PACT Act. And then there's a ton of other stuff that was added within the PACT Act, again, going back to 1955 and onward. The reason for that is because what the PACT Act codified is a process for us to be able to determine future presumptives within VA. And so we can take all this information, all this great feedback that you're giving us, everything that I'm seeing here about Fort Ord or, various other places where there may have been exposure. If you come in and you receive a screening and you file a claim, even if that's something that is not readily acknowledged as one of the presumptive conditions already outlined within the PACT Act, that doesn't mean that your claim will be denied. That does not mean that we will not aggregate that information with other clusters of your battle buddies that you may have served along with, who may be suffering from the same conditions unbeknownst to the general population. So we need this information. We need this feedback in order to ensure that we are doing what's right for our community, and making sure that we are able to add additional presumptives to the list that's growing. And that list will continue to grow. It doesn't stop just at what was passed into the law.
Melissa, can you expand upon presumptive? Because we say presumptive conditions, we say presumptive exposures, and it's part of the vocabulary that many of us use, and nobody really pushes us on it. But what do those words mean?
I like to break it down Barney style, to, quote every Army NCO ever, and to say, it's what we presume that you have as an ailment based off of where you served and when you served, full stop. So basically, we understand that under the Southwest Asia Theater of Operations, Iraq, Afghanistan, if you were deployed within the CENTCOM area of responsibility, or AOR, then that's where we presume that under your service for post 9/11, for example, for the Gulf War, those 10 or so countries, we just assume that you have been exposed to toxins just simply by being there. And that's really the main takeaway that folks need to understand about the PACT Act. They don't have to decipher, was I on burn pit duty? Was there an incinerator by me? I slept next to Trojan Spear. These are essentially regenerators, that were facilitating all of our wiring and et cetera. And so by sitting next to anything doesn't mean that that gave you a type of exposure. Just being there during that time is what we assume to be your exposure. So that in a nutshell is basically what a presumptive illness is. And we want to actually walk away from some of that technical language, because that's a great point, Megan, that we know that these are sometimes the barriers, that vernacular that we get so accustomed to within VA and within the advocacy space, that we forget that, the average veteran doesn't think about this when they take off the uniform. They don't think about presumptive conditions and having to be conversant in, administrative law in order to be able to file a claim. They just need to understand that VA is here, and understanding that because you serve at a certain point, we probably want to ensure that we are giving you benefits. Not probably, we want to ensure we're giving you benefits.
Thank you, Melissa. So the clear message that we hear all the time is that if you're a veteran and you applied before PACT Act and you were declined, you need to apply again. But what about the veteran that's 180 degrees out from that, who has a 100% disability rating? Why does he or she need to take action now with the passage of the PACT Act?
I'll jump in, and I don't know if any of my colleagues want to pile on, but the simple answer to that is help us help your battle buddies, because we need to know what else is out there. Again, this is an ever-growing list. It doesn't start or stop, rather, with the August 10th passage of the law in 2022. It continues onward as we learn more information, as we add to that list of presumptives, as we add additional countries that may not have been covered initially under the law. Many compromises that go into that passage, but we want to make sure that we are at least accounting for every veteran who has served and accounting for any care that they may need as a result of their service.
I'll add a little bit to that, Meg. You might be 100% disabled for X, Y, and Z, but if you don't have it in your records, a condition that is considered presumptive, then you might not be eligible for treatment because you never applied for it, right, in the future. And so get it in your records. But on the research side, it's absolutely vital, because that research is going to continue for years. It will be part of the cycle of just how the VA does business writ large. And that's why the PACT Act is such a game changer. I mean, it's the biggest expansion in VA benefits and care in generations, if not the history of the VA. And so, and the thing that Melissa was talking about on presumptives, from a veteran perspective, applying, previously you had to make the case that this condition I'm suffering for is as a result of my service. The PACT Act flips that on its head. You don't need to make the case. That's what presumptive means. We are automatically assuming by virtue of your service that condition is service related. So it takes the onus off the veteran and puts it where it should be, on us, on our colleagues in the healthcare side to treat and deal with it.
Thank you. Before the passage of the PACT Act, there was something called the Burn Pit Registry. I've had a number of veterans asking, if I signed up for the registry, like, now what? What does that do for me? And am I covered, or do I need to take further action?
You still need to submit a claim, and you still need to get screened. The registry is very useful because it's giving us direct access to those who have already submitted their contact information previously, and we would still encourage folks to use the registries. And we're actually improving that experience because we know we've had a lot of challenges with folks that don't have access to their DS logon account anymore, if they don't have their .mil or their service branch email anymore and unable to recover that password. We're now trying to switch that to using login.gov or ID.me and other two-factor authentication services. So know that we're working to improve that experience every day, but we encourage anyone who's already registered on the registries specifically to still file a claim and go in for your screening.
Okay. And to clarify, and I'm looking at some of the questions, they should register, they should go in even if they don't have symptoms or if they have a diagnosis. If they know they have exposure, they should take action, correct?
Yes.
Okay.
Your symptoms may develop later.
And I
Good
would
to
say
know.
they should do that for all service too. Again, this is about starting a conversation. So when you come in for care, one, enroll in VA care regardless. When you enroll in care and you're able to be screened, I'm seeing questions that, revolve around what about AFRICOM? What about Special Operation Forces deployments that are not specifically delineated within the PACT Act? I must stress, this is just the starting point of the conversation. We don't know what we don't know. I'll say, as someone who's worked within the SOF community, I absolutely understand where you may have had exposure in Central Africa or Djibouti or other places that may or may not be included. And so we can't aggregate that information if you don't file a claim or if you don't come in for care. And even as a part of your screening, while that may not fall into what's currently under the PACT Act, this is a part of the process in which we learn more and understand more about, again, targeted communities that may have been exposed through their service that is not currently acknowledged under the PACT Act.
Thank you. As amazing as the PACT Act is, sadly, it was too late for some veterans, and we're receiving questions about caregivers, widows, survivors. What, to the extent that somebody believes they were a survivor of somebody who should have been covered under the PACT Act had the timing been different, what should that surviving spouse or child do?
They should reach out to us. We're, part of the challenge with survivors is, you hint at it, Meg, in the question. Many people don't identify themselves that way. So we are actively working with partners. As a matter of fact, John led, and his team led a great listening session with nonprofits in the survivor community yesterday to help us be better at our outreach efforts in order to get the word out to survivors that they may be eligible for benefits. And what I can say is, part of it is just acknowledgement in many cases that what killed my spouse or whoever the person is who was the service member might have been service related. That's a huge aspect of it, this qualitative component that has nothing to do with benefits. Really, it's just recognition by our country that that service member, died as a result of their service. But they should by all means reach out and apply, and we're actively attempting to reach that community. And I don't know, John, if you have anything to offer there, or Melissa.
Yeah, we're hoping to improve the outreach and the experience for survivors who are applying. That is one of the big barriers that we've seen, to Steve's point, is not enough survivors and family members are applying for these benefits, and we need to find new ways to reach them, just as we need to find new ways to reach those untethered or unenrolled veterans who are probably or will likely be eligible for benefits and care because of the PACT Act. We're also going to be, not only studying on how to improve the survivor experience, we're also going to be doing more surveys to that population to better understand how we can serve those family members.
Steve, we're getting a lot of questions about the August 2023 date that you mentioned. What happens after August 2023?
So August 10th, 2023 is the last day that you can apply and get your benefits backdated to August 10th, 2022. So that's why we're doing a huge push again leading into the summer. Melissa has helped orchestrating it when she comes back from Hawaii, and we're gonna, you're gonna see the outreach. We've done thousands of events across the country, and we're not gonna stop. I mean, our employees started work when most of us were taking the day off, rightfully so, right, on January 1st to reflect on the last year. We had employees volunteering to start processing cases day one, the first day the law allowed. That's the level of passion that our colleagues bring to this mission. And so we're not going to stop, but August 10th is a big day. And then the October date that I saw a question on as well is with respect to healthcare. So benefits August 10th, healthcare in October.
So it's not that people are no longer eligible after that date, but that's the last date that they will have benefits backdated to
Correct.
previously.
Correct.
Okay.
And we want to make sure we're bringing people in that special enrollment period too, because again, that's that post 9/11 generation who may not have come in for care before. And it's important to note that the PACT Act also extends from 5 years to 10 years of care as well. And so there's a lot of changes under the law that maybe don't get advertised as well. The bottom line is that it's broad, expansive authority that is given to VA to be able to better serve you. If I had to summarize the PACT Act in a nutshell, that's what it is. It's more care, more benefits, and more authority that VA has, to include workforce authorities. We're able to expand our workforce, and we're doing huge hiring pushes right now. And for those who may be survivors and spouses, we want you especially to apply. Many veterans, as Steve noted, work at VA. We're doing a huge push for claims processors right now, for example, and making sure that we're bringing those folks in to increase our capacity to serve. That also answers the question of, well, what about the backlog? What about previous issues? What about previous denials? Please think of VA as a complete culture shift given to us under the authority of the PACT Act. The president, the country has entrusted us with being able to do more, and the PACT Act allows us that capacity to do more. If you've previously felt distrustful of VA, if you've previously heard of your friends who are reluctant to file claims, I'm seeing a few of those questions in the chat here now, please do encourage them to come back and to try VA again, because this does give us expansive authority to be able to do more and to deliver on the promises.
Now, many of those that were exposed on deployment haven't taken off their uniform yet. So they're still active military, and they don't tend to think about the VA until they're out. And we've had a couple questions pertaining to that. If they're in uniform, is there something they need to do now pertaining to the PACT Act?
Don't do like I did. Please make sure that you actually go to sick call. Actually get these things annotated while you're on active duty. That's something that we tend to power through. We have high tolerances for pain and for, it's just a cold. The next thing you know, you have a deviated septum. I might be speaking from experience. And so I say this to say, don't power through. It's okay to have these things annotated while you're still on active duty. But to my friends who are in the Guard and Reserve, there are eligibilities for when you demob. There are places where you can apply for VA care while you are still serving in the Guard and Reserve. I'll admit it's a little tricky in figuring out that space between MOB and demob, but there is room for you to be able to do that. And I'd say it's never too early to start the conversation with someone who can help walk you through the benefits, and talking whether it's with a service officer or talking directly to VA service officers, as well as VSO service officers.
Thank you, Melissa, because you're right. It's tricky in that Guard space. So, okay. But what I'm hearing, just to circle back for active duty, they should go to their medical folks and get the conditions and or their exposures documented while they're still in uniform. And that'll serve them well once they take off the uniform, correct? Okay.
Absolutely.
And part of the work we're doing too is we know there are a lot of, we call them data dependencies, right? That other departments, primarily DoD, but there are other agencies out there as well, have data that can help us, number one, move much more quickly in processing applications for benefits, but then also on the healthcare side of things as well. And so that's a lot of the work that John, Melissa, and a lot of our colleagues are doing internal to the VA, is to get us to integrate better, which hasn't always been the case historically, and not just internally, but externally with our other federal partners.
Okay. Here's a wild card that came out of the questions. I hadn't been aware of the American Association of Cancer report about 2 weeks ago pertaining to non-deployed individuals with high rates of cancer diagnoses. Any implications for PACT Act there of those people that did not deploy?
So part of our process is we have researchers who, medical researchers who look at potential exposures. They look at all the research that is out there. It's not just VA researchers. We look at our civilian counterparts, like the one you just cited. We look at the National Academy of Sciences and other federal agencies that are out there doing health-related research. And we survey it in order to help understand where the balance of evidence is with respect to potential future presumptive conditions. And so, yes, we've seen that report. It will be taken under consideration as we're looking at potential linkages to different cancers, and whether or not we would recommend to the Secretary that they be considered presumptive. So
Okay.
Hopefully that's boiled down and not too academic, which I can't get too academic anyway. I'm an infantry guy.
Thank you. Steve, you said something earlier that I'm going to circle back to. You said of people that have disability ratings that are screened, 97% of them are going to see their ratings either stay the same or increase. Do you want to speak to that 3%? Are people able to predict whether they're in that 3%? Who is that 3% that is not going to have that experience?
So I'm just going to say I have not been notified of any cases as a result of PACT applications going down. That doesn't mean that it couldn't potentially happen. We are not actively looking with that perspective anyway. The Veteran Benefits Administration is we're trying to implement the PACT Act, which is basically bringing more care and more benefits to more veterans than ever before. Most people don't realize that of the 18+ million veterans in the country, about only half of them are in the VA system. And so the PACT Act opens the aperture for so many more veterans to receive care. And what I would say is, when I retired in 2015, I had people who were actively encouraging me to seek healthcare elsewhere, because we acknowledge we've gotten a bad rap out there in a lot of different communities because of the accountability that we are held to, rightly so. And I chose intentionally to seek VA healthcare so that I would understand what our servicemen and women were being exposed to. And I will tell you, just anecdotally from my own perspective, I will not go anywhere else for treatment. I think the VA offers the most comprehensive health care that we have in our country. And I'm not the only one that says that. There are plenty of other advocates out there that will say that. And as my wife readily reminds me, I'm a complicated case, right? We veterans are complicated cases. We bring many different issues to the table for healthcare providers to address. And if you want to take your chances in the private sector with boutique healthcare, everybody has the right to make that choice, but I don't regret making this choice.
Well, John, I'm looking at you because I've heard you say many times, including today, if it's been 10 years since you tried the VA, try the VA again. And that's largely due to the efforts of, your office and the secretary's intent to change the experience for veterans.
Yeah, we listen to the voice of the customer, the voice of the veteran to make real-time process improvements. If you've had an encounter with VA, you've probably gotten a survey. We listen to the results of that survey. We answer free text comments and concerns and recommendations about your care and follow up. We use the data to then go in and do extra training with facilities and staff to make sure that they understand how to deliver a world-class experience because you deserve nothing less. Another way to put, the question earlier is, I think is that we put it before publicly, is that you're 23 times more likely for your claim to either increase or stay the same. So I think that using that, that frame of mind to file your claim, that's really the message here, and we really want to make sure that you get that. And I'm sorry, I've been writing a lot of responses in the chat, but I did ask the staff here, Meg and Jeremy's team, to share they were able to download all the questions, and then we can actually respond to them and then share them back over via email, since you all registered for this webinar. Or if y'all want to post it online, we any way that we can get y'all the information and your answers. We're just sorry that we can't type fast enough for all your questions.
Yes.
It's 32 times, John. Just fixing those numbers for you. It's 32 times more likely.
32
to
times
see
more
it
likely.
rates.
Marines and
impressive.
numbers, infantry guys and numbers and typing. We just can't keep up. So thank you.
That's
Melissa.
all right. You've got your Intel support here.
I'm intrigued by one of the questions that has come in from somebody who submitted their application prior to the PACT Act and it's still pending. If people have something pending with the VA, should they wait it out, or should they go through your processes that you've set up now?
I mean, you should continue. Your care is on a continuum of care. Same goes for your benefits experience. And so if you have something that's pending, that does not preclude you from continuing to file additional claims, or if you have additional evidence to provide supporting documentation, it's not disallowed to be able to do that. And I do want to lift up one comment that I did see in the Q&A, just circling back quickly to that 3%. There is such a thing as, change in status. And that is, the assumption that for some things that, I wouldn't necessarily say cancers that go into remission, but, for some conditions that we are able to alleviate through treatment, that could account for some of that population that falls within that 3%. The assumption is that hopefully you get better. But the reality is, as Steve, rightfully pointed to, is that our health is impacted by our service, whether stateside or downrange. This is risky business. We know that when we raise our right hand and we say, send me. And so as a part of that, the healthcare journey is complicated by that. But there is such a thing as change in status, and that could account for some of that 3%.
Thank you. Jeremy, have we hit the main questions that you're hearing from your members?
Yeah, this has been great. I had a list of them, and literally they've all been checked. And just as kind of a reminder for the VA, because the things that we're getting asked about is, how does the burn pit registry play into things now? And you touched on that. The scams is a huge thing. People are unfortunately seeing the ads almost more than they're hearing directly good information about the PACT Act and things like that. And so that's certainly got some concerns. So I'm glad we addressed that. Understanding how to get the screening if you're not already enrolled in the VA, concern about wait times increasing. And it was really good that Melissa mentioned a couple of other things that the PACT Act does, which includes allowing the VA to hire more staff. It expands from 5 to 10 years, the eligibility for VA care for transitioning service members. I mean, we really touched on what is a massive, massive bill here. And so this has been great. So I've been very happy to listen to the three folks from VA go on, because they're hitting all the high points that we've been getting and the questions that we've been getting from our members. So thank you.
Super. Steve, I was going to go to you anyway. So I see you have your hand up. Do you want to?
I just wanted to, I saw a question really early on in the Q&A that we didn't get to. And the question, I didn't catch the name of the person, but she asked, are women veterans applying? And I just want to emphatically say yes. Women veterans are the fastest growing demographic in the VA. So, and we are actively looking at, as we expand healthcare capacity, ensuring that we have women's health integrated in to our healthcare system across the network. And we have a couple flagships out there because historically we acknowledge, it may not have been as friendly as our women patients would want. And we are actively addressing that. And our Undersecretary of Health continues to drive that process on the healthcare side. So the answer to that is yes. And it looks like Melissa wants to add on.
Yeah, I just want to say, because I actually noticed the person who put that in there. So hi, Kathy. And as a woman veteran to another woman veteran, we still need your help. We still need to address this with women veterans. That trust gap is still there within women veterans. We know this is also within our Black and Brown community, pretty much anywhere that has been historically underserved. And, unfortunately, VA data matches, U.S. healthcare data, where we see those disparities in treatment historically that we are actively addressing. And so that is something that, I'd say that emphatically, yes, we are seeing women apply in record numbers, but we also want to see women continue to apply. Applying in record numbers means that, frankly, it was a low bar to clear. And we need to make sure that we need to continue directed outreach within women veterans. We're seeing events that are happening all across the country. If you go to va.gov/outreach, you'll see events that are listed where, whether it's a PACT related event or a claims clinic, information session, webinars like this, please do encourage women veterans and minority veterans to participate in those and to learn more about VA and the services that can be tailored for them, and especially for the tailored care that women receive at VA through our clinics.
Thank you. Steve, I know Secretary McDonough is incredibly committed to this implementation. Can you say a little bit about the metrics that you're tracking that the VA is pleased with, and the metrics that you're tracking that you're a little bit concerned with and working towards?
Sorry, looking for that mute button. Yeah, we unveiled a dashboard of metrics publicly. It's the same dashboard we use internally to manage implementation. It's only about a month ago, but we've already done 3 iterations of that. And so frankly, our ability to process cases is higher than we anticipated. And it continues to go up. And so that has been something that has helped the backlog not to grow as quickly as we anticipated. So those have been metrics that are positive. On the hiring side, we have made huge inroads hiring both for people who are processing claims, but also on the healthcare side. We've hired at historic rates in order to expand and have the capacity. Now, some of the things we're concerned about, we still have a challenge with our time to onboard, time to hire, time to fill, basically. There's a glide slope there with respect to how quickly we can train people to either file claims or be prepared to operate as a healthcare provider inside of our network. And we're actively working on processes to better streamline that. So those are just a couple. We're just one update on that. You can find that on the PACT Act webpage on the VA's site, va.gov/PACT. But our goal is by this summer to have it into a more customizable user experience, right? So the metrics that customers are interested in, they can go to. Obviously, if I'm a veteran, I might want to look at, how quickly cases are being processed. But if I'm a member of Congress, I want to know how many veterans in my district have applied. And there are a lot of other consumers. Jeremy's probably looking for different metrics than, you are, Meg, but we are actively working in that space and responding to input from all our different stakeholders out there. And just to reiterate our approach, and this is straight from the top with Secretary McDonough, we're veteran-centric, number one, and we mean that inclusively. Veterans, caregivers, family members, survivors. We're transparent with our stakeholders, and we're collaborative. We're working in the space to receive feedback and just get better. We acknowledge when we're not where we'd like to be, and we ask for your help in helping us get there.
Thank you. Thanks to all four of you. What a tremendous panel. We appreciate you bringing your expertise and your willingness to talk to this. Thank you to all the participants. We had great participation and attendance for this. The Bob Woodruff Foundation will do everything we can to circle back on questions and resources that were mentioned here. We'll send it out to those who were registered. But again, for our panelists, thank you for your time here today, but thank you for what you're doing every day to help those who were listening to this panel and the rest of the people in our community. Thank you.